Today, some of you and might know, majority of you may not know, today is a no smoking day. As majority of the people are aware of the adverse events of smoking, it is injurious to health in the form of its predominant effect on lungs and it causes cancer. But how many of them are aware that it profoundly affects the major vital organs of the body, the cardiovascular system? I am Dr. Harsha, consultant interventional cardiologist at Poulomi hospitals, having 15 years clinical experience and 9 years of vast experience in the field of cardiology. So majority of us have little evidence or information that smoking predominantly affects the major blood vessels of our heart, brain, or multiple organs. It leads to swelling of the blood vessels lining the cells lining the blood vessels of various organs. The chemicals and the smoke leads to deposition of fat, calcium leading to swelling and inflammation of these cells, which leads to various effects. So the first being the atherosclerosis, which leads to stiffening of the blood vessels, and also these blood vessels get narrowed down and also become thicker, and leading to major adverse effects in the form of coronary artery disease. The blood vessels which are supplying to the muscles of the heart get clogged, and deposition of this fat because of the chemicals in the smoke leads to sudden occlusion, leading to various acute emergencies of heart, and also people suffering from chronic chest pain, and also people suffer from strokes of brain, where the process is again deposition of cholesterol and atherosclerosis, leading to brain strokes, disability and bedridden, and these patients lead to major burden to the family. And peripheral artery disease, where the blood vessels of our hand, legs get occluded, patient having lots of suffering in the form of leg pain, hand pain, and also having pain in the stomach, where the blood vessels to the intestine also get occluded. And atherosclerosis leads to weakening of the blood vessels of the abdomen, which is the aorta, or even the large blood vessels, leading to weakening and bulging of this aorta. So these bulgings can rupture suddenly and leads to an acute life-threatening event. So friends, smoking not only affects lungs, it predominantly causes cardiovascular disease with high morbidity and majority of people getting hospitalization. And also you have to remember, passive smoking, smokers have to take responsibility for their family members, because they indirectly cause all the effects which they are undergoing on their family members who are just a passive smoker. It is very difficult to quit smoking, but there are currently many strategies and resources that help the smokers to quit smoking. Why is it important? Because within 5 years of quitting smoking, a smoker can reach the status of the risk that is equivalent, that is in non-smokers. So friends, it's never too late to stop smoking, and stop smoking, save yourselves and save your family.